Suzette, she needs some Botox today, and so I figured it was a good idea to go over where I inject and how we charge for where we inject, because there's a lot of confusion between areas and units. So I work in units because I feel that everybody doesn't get the same amount of units to have the same effect on each area of their face. So I think if you need fewer units, you should have to pay less rather than have areas where you charge for an area. It doesn't make a lot of sense to me because you might need very little in one area and what everybody else sort of gets in every other area. So I just keep it at units, and it makes it nice and easy to do the math. A unit is just a small aliquot of either Botox or Dysport. Botox comes in a 100-unit vial. Dysport comes in a 300-unit vial. They're not interchangeable, and it's not 3-to-1 necessarily. So we'll talk about Botox because it keeps it simple. So when people talk about areas, they're talking about the forehead, the glabella, and they're talking about crow's feet. So the studies that were done showed that approximately 10 units of Botox per side is adequate to treat that and stop the crow's feet from moving. The other thing that it does is, what it does is stop the orbicularis from moving and therefore stop the crow's feet from forming. It also helps elevate the brow, but you have to put just a little more in this area here, which calms down the orbicularis muscle, which is a depressor of that brow. The glabella, wrinkle your forehead, Ro. She's had a little bit. This is the procerus muscle. This helps pop up that medial brow a little bit. And then there's two paired muscles here called the corrugators. And I typically put about 20 units in. Some people need a little more. The corrugator runs deep to the frontalis muscle, so you actually have to put your needle through the first muscle, then into the deeper muscle, which is the corrugator. That's why some people come in and they don't have great results from their Botox from some places because they don't know that the corrugator muscle, which is the muscle that pulls in like this, is actually deeper than the muscle that runs in the forehead. So raise your forehead, please. So that muscle here is the frontalis muscle. It's two paired muscles. It usually looks like this. There's actually a gap in between the two muscles in the middle a little bit, but mostly this muscle runs from right down here, from here all the way up, and that raises your brow. I do not put Botox in this area here typically because that is an area that creates facial expression. And most people that come in to see me want to maintain some facial expression. So I typically use Botox in these areas up here to stop the forehead from moving. Raise your brow. So I usually stay in this area. Now, having said that, she doesn't need a ton of Botox in that area, where somebody else might need a great deal more. And it depends on the height of the hairline, it depends on how much motion they want, it depends on a lot of things. So again, I go by units and not areas. So if you come to see me, you can expect to get approximately 20 units of Botox in the glabella region, approximately 10 units of Botox in each crow's foot, shall we say, and then anywhere between 8 to 16 units in the forehead, and that's where the difference is. Anyway, I hope that makes sense.